KTRS. Tony Messenger, St. Louis Post-Dispatch columnist and KTRS contributor every Tuesday and Thursday. Good morning, Tony Messenger.
Good morning. How you doing?
We're doing good. Thanks for checking in. You wrote a column, I guess it was last Friday or Thursday, I guess, about the friend of yours who you met during your cancer treatments. It was a wonderful story, sad story, that your cancer is doing fine, as you wrote in your article, but this friend you've found, and fill in the details for us, the cancer returned, and he's having some trouble. Fill us in on the details.
Yeah, so his name is Jim Hafner, and his cancer didn't necessarily return. He just got a different cancer. He's got pancreatic cancer, and it spread to his liver. And his doctors had proposed a type of treatment in which some radiation is inserted into the liver. And the insurance company, in this case Coventry One, which is owned by Aetna, said no. And so they protested. They called for a peer-to-peer review. And what happened is the peers, his doctors, who are, medical oncologists and radiologists and experts in the field, ended up on the phone with a family physician from Franklin, Tennessee, who the insurance company chose to be the peer-to-peer, and they denied the treatment again. So in the time since I have written about Mr. Hafner's situation, they have appealed to the Department of Insurance, and my understanding is, although it is not final yet, that they feel good about their chances to win their appeal at this point.
One of the things you pointed out in the story was that the pharmaceutical company was going to charge the hospital, and I think I have these numbers right, $14,000, but the hospital was going to charge the patient $44,000 for this treatment.
So what happened was when the Hafters realized, hey, we got to figure out how to do this surgery one way or the other. Let's figure out what the cost of the medicine is. Because the crazy thing is the insurance company agreed to pay for the hospitalization and the prep work and all of the stuff that goes into the surgery, except for the specific medicine that would stop the cancer from spreading in the liver. And so they're like, what's the medicine cost? So they emailed the advocate at the drug company. The drug company sent them detailed information. We charge the hospital $16,000 per treatment, and it's 2 treatments. And so then they called the hospital, in this case BJC, and said, what will you charge me for the medicine? And it was $44,000 per treatment. My understanding also is that BJC has since called them after the column ran and said, oh, wait a minute. They turned you down because they're calling it experimental. If that's the case, we will write off our cost. And so lots of good things are happening for the family at this point, leading up to hopefully a successful surgery to at least stop the cancer from spreading in the liver. But it was just an eye-opening experience for them to find out that, wait a minute, the drug costs the drug company costs $16,000. You're going to charge me $44,000. And one of the reasons was they would have been self-pay. The way that our medical system works these days is there's different charges if you're on insurance because those prices get negotiated. And sometimes if you don't have insurance, you actually get charged significantly more than what somebody else might get charged. It's one of the real vagaries of our healthcare system that ultimately is not very transparent.
I thought the man had insurance, picked insurance, and was paying the premiums because he was somewhat susceptible to cancer.
Yeah, he had very good insurance. He was always paying the premiums. He's an attorney, and so he's self-employed and has to pay a relatively expensive premium. They've got 3 children, all girls, 1 in high school, 2 in college, and paying their premiums and everything. So, this is one of those stories in which you look at it and you're just like, you got to be kidding me. It's not like they were asking to be, flown to India or Mexico for some sort of experimental treatment. This is an accepted treatment. It is a standard treatment. It is a treatment that his doctors recommended. And hopefully the decision is going to get overturned and he's going to have surgery that will at least prolong his life. You know, the sad part of the story is pancreatic cancer is not one of those that is easy to treat, and he understands, and his family understands that you know, he may not be living to be 80 or 90 years old at this point. But the doctors believe that if they can stop it in the liver, they can definitely prolong you know, his life for a period of time.
From what I understand, and from the article and what a couple people called up and talked about, this drug or this treatment is seeing some great results with his cancer. However, it's approved for other cancers. Doctors are using it for this cancer and seeing some very good results with his cancer.
Yes, they're seeing results. And the one complicating factor with Mr. Hafner's cancer is it doesn't seem to, the doctors can't clearly identify it. Some cancers, you know, they go back into the lab and they regrow the cells, and they're like, this is X cancer, this is Y cancer. It clearly started here and developed into this. For instance, when I had head and neck cancer, my doctors were able to clearly identify, you know, what kind of cancer it is and what the treatment was, and it worked very well. And this is a more complicated cancer, but it is a cancer that is mimicking other cancers that have generally done very well with this kind of treatment, specifically in the liver. And his very high quality, you know, well-respected oncologists and radiologists at Siteman Cancer Center said, this is the treatment, this is what we want to do. And the insurance company got in the way and said, no, we don't think so.
There's so many things that are terrible about this story. He's a lawyer, clearly well-educated, but was being treated and pushed around by the powers that be in the healthcare industrial complex. Unless he has access to you, unless Jimmy Kimmel has access to national television audiences, unless I have access to a microphone to call some of these people out, these things go on every single day.
Well, and that was one of the things that we talked about. You know, the family felt, on one hand, they wanted the publicity, they wanted the insurance company to pay for this. On the other hand, they felt a little bit bad about coming to me, realizing that they're people of relative means. And when Mr. Hafner was being treated for his previous cancer, like me, he had a head and neck cancer. He remembers receiving treatment. He was at St. Louis University, and a lot of the people that he was receiving chemo with were from less fortunate backgrounds. And he would sometimes find himself after chemo downstairs ready to go to his car, and one of the guys that was in the chair next to him was waiting on a bus, and you know, he would give him a ride home. And when we were talking about this cancer, he was talking about people that, you know, don't have access to the media, don't have you know, the means to protest and go through appeals and either the knowledge or the patience or whatever to go through that stuff. And that's what drove them to call me. It's this idea that insurance companies say no on these things all the time, and it's a nameless, faceless person on a phone, you know, several states away saying, you know, no, we're not going to cover this. And this sort of thing happens all the time. My colleague Samantha Liss on our business pages is actually working on a longer-term story on this topic. She's been talking to the Hafners and other people like them, and talking to insurance experts about how, unfortunately, common this sort of thing is, and how sometimes the peer-to-peer review is not actually a peer-to-peer review. And it's going to be a very important story when that's published.
All right, Tony, I'm short on time. In this particular case, BJC has backed off. Is he getting the treatment? Where are we now?
My understanding is that I don't want to say too much because I haven't gotten full confirmation.
Sure.
But my understanding from the family is that they're getting good news both from BJC and the Department of Insurance as it relates to the appeal of their situation. The family feels good that the surgery is going to go forward, and the proper people are going to pay for it.
I'm sure you'll keep us up to date in your column. Tony, nice article. Have a good day. Thanks, Tony.
Great. Talk to you later.
You got it. St. Louis Post-Dispatch columnist Tony Messenger, and Tuesdays and Thursdays here on the Big 550 KTRS. 8:30, Big 550 KTRS.